Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. What's the best testing for nonverbal children pertaining to annual testing to update present level in IEP? My son is 10 years old and nonverbal.
Right. So it's a different question when you ask about an IEP, because an IEP is based on educational goals and not on, like, let's say, you know, intelligence quotient or language functioning or something like that. So you're not necessarily going to be doing testing as in standardized testing, because standardized testing, it's just, there aren't standardized tests for educational functioning, except there are developmental tests, like the 𝗔𝗕𝗢𝗏 is actually a pretty good test that looks at, you know, functioning levels. But there are lots of achievement tests that are, they're not really tests, they're kind of standards. And so, like, you look at and you see what the individual is expected to do in that grade, and then you list the things they're not able to do, and those become IEP goals. Depending on your school district, they might allow only a few IEP goals. Like, one of the tactics that one of our big school districts here in the LA area was doing was, like, you are limited to no more than 3 IEP goals, which, you know, makes it very hard.
Gosh.
Oh, did you not know that?
No, that's inexcusable.
That was LAUSD, yeah. So we had to always, like, we'd have 30 goals, and we'd have to, like, look at reducing them to 3.
That's ridiculous.
So, but the issue is with IEPs, they will limit you to a certain number of goals. Now, I wouldn't necessarily, I would really look at the functioning of the child. We used to use a developmental test that we had made, which was for skills, which was kind of the curriculum we'd built. You don't need that. You can look at any testing that shows a deficit in your child's functioning level, whether it is across academics, behavior, social. You definitely want to touch social, language. So, like, for instance, goals that might be appropriate for your child would have to do with their ability or inability to interact with other kids, to follow the teacher's instructions, to pay attention to the particular homework that's being done, to be able to academically keep up with the content, like the math or the English or whatever it is that they're teaching. So it's a variety of different skills that can be taught or supported in school. So, for instance, it's not going to be something like, oh, my child doesn't know how to dress himself, because that's not something they're going to want to teach in school. It has to be stuff that is taught in school. So clearly you can look at a curriculum from your school district and see what is expected of your child. You can also look at just social functioning for the age of your child. You can look all these things up online, actually. Like, what are social expectations for a child of 10 years of age, or whatever, 10 years of age. The 𝗔𝗕𝗢𝗏, as I said, has a lot of these types of goals. There's a lot of, I don't know if it goes up to that age though, 10 years. So there's a lot of, if you've had any prior speech therapy testing, that will have some goals. It's a broad array of skills that can go into an IEP as long as they're teachable in school. Like, for instance, your child is maybe not able to go and use the facilities alone. That would be a goal. Is your child able to put their backpack in the location they're meant to? That would be a goal. Is your child able to stand in line with all the other kids? That would be a goal. Is your child able to follow the math instructions? Those are, so it could be academic, it could be social, any of those types of things would constitute a goal.
She's written in several times. Have you been watching the updates that she's given?
No.
That she said she was originally looking for what kind of testing, cognitive, developmental, and et cetera, that they currently have 10 goals in the IEP. She wants to know specifically what tests should she ask for, and she says that the developmental age is toddler.
Okay, so you're looking at like the first test that I would request is probably the Merrill-Palmer, 2 words. It's an IQ test for nonverbal individuals. You could also do the LEITER, revised LEITER, LEITER. Both of those are IQ tests, but what comes out of them is a bunch of skills that are below age. So, and they're nonverbal tests. So it'll give you an idea of some of the things that the child is not yet able to do. You would also definitely want to fill out a Vineland, which is a questionnaire that you fill out, or the teacher, but you probably should. And then in the Vineland, you'll see a ton of activities that your child would benefit from, daily living activities, those types of things, and you can absolutely put those as goals. Now, if your child's nonverbal, my personal choice would be to make sure that I give the school some goals in terms of communication. And those could be based on a picture exchange system or based on keyboarding. Like I would like the child to learn sight words perhaps or icons that they could request things. And that would be a goal that the school would have to teach, which is, when I want water, this is the icon for it. When I want to go to the bathroom, this is the icon for it. It's because I don't know your child's level very well. It's anything that would allow the child to communicate their needs better. Yeah. Those goals are super, super important, because if you're not able to communicate your needs, you become frustrated and annoyed and maybe angry, and then you have challenging behaviors. Yeah. So that would probably be some of the stuff that I would look at.
Okay. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.